Bismillahirrahmanirrahim. In the name of Almighty Allah, who is most gracious and merciful. Assalamu alaikum. This is Dr. Arshad Ali Bhutto. In this video, let's talk about the coronavirus because today everyone is talking about the coronavirus. In my opinion, there would be a few people right now on the face of the earth unaware of the word corona. When the word corona comes, it brings the goosebumps in the fear of the death. When the word corona comes, a concept of the deadly disease is born, especially in the minds of the people not related to the medical profession. Today, you can say that the corona is the second name of the death. Corona is actually the virus belonging to the corona family of the viruses. It is the single positive RNA strained non-segmented virus. Corona is known as the coronavirus because of its shape and an electron microscope resembles to that of the crown. And the corona word is the Latin word which means the crown. Most of the animals are infected with this virus. Wide varieties of the species of especially the snakes, bats and the penguins are infected with it. But there are a few strains responsible for the disease in the humans. And these strains are human coronavirus 2290 and human coronavirus OC43. These are the innocent strains responsible for causing disease in the human. They constitute about the 15% of the flu cases in humankind, other than rhino family viruses and the influenza family. You would be surprised to know that 80% of the population is immune to these innocent strains of the coronavirus. That means in their lifetime they might have encountered these strains and developed immunity against them. Now question arises that why the few strains of the coronavirus are responsible for causing the mild disease and why the few are responsible for causing the serious illness in the humans. The reason behind is that the innocent strains, as I told you, the 2290 and the OC43, they are responsible for causing the localized inflammation in the nasopharynx. They actually bind with the receptors, that is the aminopeptidase N receptor and the sialic acid receptors in the ciliated epithelium of the nasopharynx. While these strains, which are responsible for causing the serious illness such as the SARS-1 or the MERS or the SARS-2, now the COVID-19, they are responsible for causing the systemic illness in the human body by binding with the receptors, that is the angiotensin converting enzyme 2 receptors. So when they bind with these receptors, a wide variety of the immune response is stimulated. A wide variety of the inflammation occurs in the lungs, and this is known as the ARDS, acute respiratory distress syndrome. Wide variety of the inflammation occurs in the heart, and it's known as the myocarditis. Inflammation occurs in the kidneys, and it's known as the nephritis. So ultimately, these strains result into the multi-organ dysfunction. They put the patient at the risk of the septicemia, and patient ultimately dies. Therefore, these strains are the dangerous as compared to its innocent strains. Clinical features of the coronavirus disease, the first which is now studied, the first symptom which is now has been studied or published into the studies is the loss of the smell and the loss of the taste. However, the other features are the fever, myalgia, fatigueness, runny nose, non-productive cough, and in 25% of the cases, the diarrhea. Incubation period of the coronavirus is 1 to 7 days, but may last from 1 to 14 days. In the second week after the onset of these symptoms, patient may develop the multi-organ dysfunction. Up to now, no medical treatment has been approved by the FDA, but there are the studies that chloroquine can be given, oseltamivir can be given, ribavirin can be given, and the remdesivir can be given. These are the antiviral agents other than chloroquine, which is the anti-malarial drug. These can be given, but still now the FDA has not approved the specific treatment for this disease. The best that you can do for this virus is the prevention, because this virus itself does not transmit, it's you who transmit it. The best that you can do right now is to prevent yourself from being infected with it. And the preventions are to maintain the social distance. Wash your hands frequently. If you are going to use the washroom, then clean your hands in a proper way. Avoid the crowds. Because, dear friends, a disease, especially an infectious disease, never respects the borders. It never respects the age. It never respects the gender. It never respects the religion. मेरे भाइयों, बीमारी का ना कोई दीन होता है ना कोई धर्म होता है. वो ये नहीं देखती कि बूढ़ा है या बच्चा है. वो ये नहीं देखती कि औरत है या मर्द है. A pathogen just requires the human body to cause the disease. Therefore, my message to all of you is to stay home, stay safe.